everyone. I'm Dr. Arda. I'm the aesthetic and the plastic surgeon, and we are doing almost every aesthetic operations that fits on patients. First of all, we will talk about the immediate post-operative care, and you will be at the hospital. It depends on your operation. It can be like 1 day or 2 days, and we will give you some medications, and after the operation, when you need to discharge, we will explain you what you need to take and what you need to be careful about. It's like the antibiotics, the painkillers, and the bandages, and the antiseptic solutions, and some antibiotic ointments. So just after the operation, you need to drink water, at least 2.5 liters, and your diet needs to be protein. Protein is helping us to healing faster. And the second topic we will talk about is cleaning and hygiene practices. So after the operation, generally you're going to have some drains. They are collecting the blood and the fluid from the inside under the skin, and we will arrange another check for you after the operation, generally 2 days after, and until that time you need to wear your garments and careful about your movements. I will explain everything for you, and then when we take out the drains, I will explain how you need to clean the surgical sites with antiseptic solutions and how you need to use the ointments, like once a day on the tapes, without the tapes. Those are some important stuff for us, and also you need to be careful about your movements. Like, I don't want you to lift your arms too much. I don't want you to lift heavy stuff. If you had a tummy tuck surgery, you need to lean forward a little bit, like 20 degrees, and to prevent the tension on the surgical site. You need to be gentle about those stuff, and I will explain everything to you after the operation and also before the operation. The third topic we will talk about is the wound care and the healing process. The healing process is a long time, and we need to be patient about it. Generally, it can be changed for every patient, like 6 months to 1 year. And so, at the first period, we can think it like a step by step. At the first period, like for 1 month, you're going to have some compression garments, and those are really important for us because they are making some compression on the operation sites, and they are preventing bleeding, hematoma and seroma, and the other problems we can have after the operation. So you're going to wear your garments. You need to take shower at least at every 2 days, and with the soap and the water, don't worry, they're not going to be a problem for us. Just let it dry and apply your antiseptic solutions. We will use some surgical tapes on the incisions, and they are also helping us with the wound care and the wound healing processes. And after that, when we complete the first month, you can start some exercise. You're not going to be fully immobilized after the operation. We want you to walk, but first with slow motions, and from now you need to increase the rate. And after first month you can start some exercise, you can do whatever you want, you can have some social occasions, but I want you to take everything in your mind that you had an operation, and try to be careful about it, and let your body do everything for you. The fourth topic is managing the discomfort and the sensations. With certain operations like breast lift, like tummy tuck or liposuction, you can have some sensation problems. They are 90% generally be okay with the time, but we need to be patient. And I can recommend you some massage or some diets or some sports to deal with those. And sometimes after the breast lift or the breast reduction surgery, you can have some feeling problems on the nipples and the areola, and they will be gone after like 9 months to 1 year. And at the operation, we are cutting the nerve fibers, and they are healing again. But the nerve healing period is a little bit long, so if we need, we can take some vitamin supplements, and it will help us with those situations. And also generally after the liposuction surgery, the skin is swelling more than before the operation. So we are recommending massage therapies for the lymph drainage. This is actually an important part to heal your body. The fifth topic is the protecting the surgical area, and we are using some compression garments like surgical bras and the other ones to protect the surgical area. In addition to this, we are using some surgical tapes, some plasters and bandages to protect those areas, to protect it from infection, and also those garments are minimizing your movements. So in your mind, you're going to have a special thought that you had an operation like from the arm and I need to protect it because I'm feeling that garment. And the medication we give you, especially for the antibiotics, and helps us to protect the surgical area from the infection. The sixth topic is the dietary and the lifestyle recommendations. There's the one important point on this topic is before the operation, we need to prepare you for the operation. So I want you to quit smoking at least 1 week ago and stop taking alcohol like 1 month ago to prevent any problem at the operation table and after the operation. This point is important because smoking can reduce the oxygen level that your tissue take from the air, and it will affect our healing process too much. Also, after the operation, I want you to stop smoking for 1 month. It's better to quit, but if you stop it for 1 month, it would be better. And also taking antibiotic or herbal medicines can affect your clotting and act like some blood thinners and causes bleeding and hematoma. This part is important before the operation and just after the operation. After 1 week from the operation, I will let you to take your vitamin supplements and the other stuff you are using with no problem. After the operation, you're going to have special compression garments and they will limit your physical activities, and we want this one. But you will be mobilized, you will walk, and like it will be different for every operation. Like for arm lift, we will use the garments for 3 weeks. For the facelift, neck lift, we will use the face mask for 3 weeks, and the other ones around 1 month. After, you will take your garments out and you can start resuming your regular activities. But generally, I will let you start the exercise after the 2nd month. The last topic is the follow-up appointments and communication. So you will have an operation, and when you discharge from the hospital, our team will organize everything for you. You will come here to our clinic and we will make a check for you, and if you have drains, we will take them out, we will change your bandages, and we will inform you all the other stuff, how you're going to continue with the bandages, with the surgical tapes and the garments. And after that, if you will stay long enough in Istanbul, we will organize another check before you go back to your country. If you have any problem or if you think that you need a follow-up, you can always contact us and we can arrange a video call for you, or you can send us your pictures of the operation site and we can give you the recommendations, what you need to do. We are sure that the major complications and the big problems will happen generally at the first week. So when you go back, we will organize and manage the other stuff for you from the video call. And also we will give you extra medication in case of any problem for a precaution, and we will try to take everything better and easier for you at the healing process.